The Civil War was known to be the end of the medical Middle Ages. There was little knowledge about what caused the disease, how to stop it, and how to cure it. When the war began, there were only 98 medical officers, and the Confederacy only had 24. By 1865, there were 13,000. The most common injury was being wounded under enemy fire, which usually led to amputation to prevent infection, since antibiotics had not been discovered. Men were partially sedated with chloroform or alcohol before the surgeries to prevent pain. This method usually worked, but having to witness the horrors of an amputation usually caused the patient to scream uncontrollably. Infection was the most common cause of death among soldiers. One witness described the surgeon's tent like this. Tables about breast high had been erected upon which the screaming victims were having legs and arms cut off. The surgeons and their assistants, stripped to the waist and bespattered with blood, stood around, some holding the poor fellows, while others, armed with long bloody knives and saws, cut and sawed away with frightful rapidity, throwing the mangled limbs on a pile nearby as soon as removed. Chances of survival were about 1 in 4. The medical staff was underqualified and lacked medical supplies. There was an extremely high risk of infection. Surgeons were aware of cleanliness, but did not know how to sterilize equipment and would go days without washing hands and equipment due to lack of water. Bacteria such as Staph aureus and Strep pyogenes cause toxins to be released into the bloodstream and result in death. Gangrene, or rotting away of the flesh, was also common after surgery. About half the deaths were due to intestinal disorders, mainly typhoid fever, diarrhea, and dysentery. The remainder died of pneumonia and tuberculosis. Before the American Civil War, armies tended to be small, mainly because of logistics of supplies and training. Inaccuracies of musket fire caused casualty rates to be lower than they should be. The building of railroads, industrial production, and canned food invented after the Civil War called for much larger armies along with the mini-bell musket for higher casualties. Before the start of the Civil War, there were no plans in place to treat wounded or sick Union soldiers. Commanders believed that the war would be brief and creating a long-standing source of medical care would be pointless. After the appointment of General George B. McClellan and the organization of the Army of the Potomac, things changed. General McClellan appointed the first medical director, Charles S. Tripple. Tripple organized plans for surgeons to travel with armies in the field and the creation of regular hospitals for wounded soldiers to be treated at. On May 25, 1861, orders issued to each regiment to recruit 1 surgeon and 1 assistant before being deployed. After it became apparent that many soldiers were dying due to lack of medical treatment, another doctor was appointed as the 3rd medical director, and a new ambulance corps was set up. Each regiment was assigned 2 wagons. Field hospitals initially were open air. Tent hospitals came around in 1862 and could only have 6 patients at a time. Wounded soldiers had to be cared for in the open air, which obviously was not sanitary. Nurses were enlisted as the war went on. There was at least 1 nurse per 10 patients. By the end of 1862, hospitals were regularly being stocked with medical supplies, such as medical books, medicine, furniture, containers, spoons, vials, bedding, and so on. Divisional hospitals were being appointed. The new divisional hospitals began keeping medical records, and they were placed at a safe distance from the battlefield so patients could safely be transported from regimental or brigade hospitals. The Confederate Army was quicker to react to the urgent need of hospitals, but were at a disadvantage because of the lack of resources by the government. The medical department was created under the rule of President Jefferson Davis. David C. DeLeon was appointed Surgeon General. DeLeon had little knowledge about military medicine, so after the Battle of the Manassas, the hospitals became so overwhelmed with wounded, many had to be sent to hospitals in the South. Later, Davis replaced DeLeon with Samuel Preston Moore. At first, the Confederacy just sent wounded soldiers home, but as larger hospitals were built, this became less important. Surgeon recruits at first brought their own supplies, but the government eventually supplied them with packs of medical instruments. It was the responsibility of the regimental surgeons to decide whether soldiers could return to battle or be sent to the general hospitals. Each regiment was responsible for transportation. Many advancements in medicine came about during the Civil War. Records were kept on surgical procedures, and a greater understanding of cleanliness, diet, and disease came about. Lastly, the field of nursing became popular, and a new respect for women in the medical field came about.